To take you live now to Sydney, where New South Wales Health Minister Brad Hazzard is speaking.
Restrictions that we've all lived under the last few months, it's crucial, absolutely crucial, that people come forward for testing if they have the slightest hint of any respiratory issues at all, a cough, cold, temperature, whatever it may be. We now have a total of 411,618 people who have been tested in New South Wales, so we're fast closing in on 500,000 people. And I want to thank the community, because if the community don't stay on board with us, with public health and with the government in terms of going and having the testing, as we free up the restrictions, as we move towards that, that will cause a huge problem for us if people are not going and having that testing. We need to track and know precisely where this virus is amongst our community in order to keep us all safe. Good news is 2,653 people have recovered from this virus here in New South Wales, and that's a very positive message to people. You can recover, but of course you can also have a very unfortunate outcome as well. Of that 411,000, I just emphasise, of all the people who have been tested in New South Wales, 408,532. It's a huge number, have actually been tested and proved negative. So don't be fearful of coming forward and being tested. You're keeping yourself, you're keeping your family, you're keeping your community safe, but also the chances are your test is going to be negative. I want to emphasise again the danger of young people who might be asymptomatic or who might have mild symptoms. In the age bracket 20 to 29, of the total of 3,086 cases, there have been 652 just in that 20 to 29 age bracket. So 1 in 5, 21% of all of the people who have tested positive have been in that 20 to 29 age bracket. And indeed, if you look at the next age bracket of 30 to 39, by the time you put both of those together, it's just on almost 40%, it's 38%. Almost 40% of all cases are in that younger age bracket where we don't expect, we hope and don't expect, there will be a profound issues. It does happen, but less frequently than older people. But the impact of those young people, particularly as we're freeing up our restrictions, particularly around clubs and hotels and so on, we need a very powerful message and reminder to the fact that these young people who may think they are invincible are actually not invincible, number one, and number two, that they can be asymptomatic, they can have no symptoms, or they can have very mild symptoms, and they can transfer those symptoms to people who are extremely vulnerable. And we know that anybody over the age of 50 who have other health issues, comorbidities, or anybody over the age of 70 are really in the danger zones. They are right smack bang in the danger zones. So young people, whilst they're enjoying these new freedoms, as we move forward, also have to realise with these freedoms come big responsibilities. If you're going to keep your family, your friends and your community, your grandparents safe, you need to be really, really careful. Social distancing is key. If you drop off the social distancing, if you fail to stick to that 1.5 metres distance, you're putting everybody at risk. You also need to understand that washing your hands regularly before you go into the place where you're going to have your dinner or your drinks, absolutely crucial. While you're there, keep doing it. While you're there, keep washing your hands or using the hand hygiene products. And when you leave, and on the way out, do it again. Because if you don't, then you may well be the precise cause of why your grandparents or somebody else's grandparents or somebody else that you know who have some comorbidities might be a victim of this terrible COVID-19 virus. As I said before, we're continuing to test. It's a partnership, though, with the community. We need everybody in the community to understand one little symptom, just one little symptom of anything that looks like a cough or a cold or flu, go and get tested. It's free, it costs you nothing, but it could save your life and it could save somebody else's. The final comment I'll make today is just in terms of the $34 million program. As I said earlier, Anwar Hassan is a physiotherapist with an enormous amount of experience, and he's going to be talking to us today about this $34 million program. So important that we have anybody who's ever been in hospital would know that chances are physiotherapists come and stood by your bed and given you some advice before you leave. But in this particular situation where this virus is so dangerous and has such a massive impact on people's lungs, on their respiratory system, that we need physiotherapists with enormous expertise in that area. And although we see only a relatively small number at the moment in our ICUs and in our hospitals, I have to say it is still quite possible, very possible, that we could increase, or we could see an increase in those numbers, particularly if people don't take seriously their obligation to socially distance, to physically distance by 1.5 metres and follow hand hygiene. So public health and I as Health Minister, we're all on high alert that as people actually get their freedoms back, if they don't actually respond to their own responsibilities to themselves and to the community, we could see an increase. And that's the last thing I want to see. So I'll ask, first of all, Dr Selvey to speak. Then I'll ask Assistant Commissioner Cassar to speak. And then I'll ask Amlar to give us some insights into the training program and how this virus actually attacks people, because he's actually personally cared for about five patients in Nepean. He's seen it up close and personal and just how tough it can be for those patients. So first of all, Christine. Dr Selvey, I should say.
Thank you, Minister. So, as the Minister has already said, we just had only 3 cases overnight. All of those 3 cases to 8 p.m. yesterday. All 3 of those were people in quarantine, in the hotel quarantine. 2 were from Pakistan and 1 from the USA. And those people are really not posing any risk of community transmission in New South Wales because they are in hotel quarantine, and they'll remain in isolation until they're cleared of the virus. I also want to echo Minister Hazzard's call to everyone with any sort of symptoms to come to get tested. So that's any respiratory symptom, even a scratchy throat, a little bit of a cough, some sinus pain, slightly runny nose, any of those respiratory symptoms, also symptoms of general viral illness like muscle aches and pains, joint pains, feeling extreme tiredness and headache. Please, people come forward and get tested. The reason being that if we detect cases, then we can stop any onward transmission from those people. And that's done through contact tracing and quarantining of those contacts so that trains of transmission become interrupted. If people aren't tested, then onward transmission will happen and we'll continue to have, or we'll have escalating cases. So very, very important that anyone with symptoms does come forward and get tested so that we can reduce that onward spread.